Mr. Speaker, sir, since 8th of January 2023, yesterday, China has started resuming outbound leisure travel and removed quarantine requirements for returning travelers into China. Singaporeans are naturally worried that this will lead to more people here, especially the vulnerable, falling severely ill. Further, there are concerns that this will trigger a fresh infection wave that can bring back social restrictions and undo what we have achieved painstakingly over the past 3 years. The government and certainly the MTF and MOH are acutely aware of these concerns because protecting Singaporeans and maintaining our freedom and normal lives have been our primary objectives throughout this pandemic journey. As I have said a few times publicly over the past months, the pandemic is not over, and we need to be especially mindful when China opens up. There will be risk and uncertainties because the virus will be sweeping through a population of 1.4 billion, mostly naive, COVID-19 naive, and that is now happening. In addition, we have also anticipated that there would be a winter wave of infections across countries in the Northern Hemisphere. This has also happened in many countries, such as the US, Europe, Japan, South Korea. Prior to this, many countries have dismantled all their border measures. A few have now reinstated the measures and announced new measures. As for Singapore, we have never dismantled all our border measures and have kept relevant measures precisely because we anticipated this risk. Today, I will explain why we decided on our current measures and why they are appropriate given our current context and circumstances. But before that, let me report on the outcomes of the measures. After all, the proof of the pudding is in the eating. Imported infections today account for about 5 to 10% of total cases reported every day. Cases have fallen down some, so sometimes you see every day it can be 15%, 20%. Yeah. By and large, throughout the pandemic, 5 to 10% of total cases reported every day. The 4 weeks running up to 1st January 2023 was probably one of the most difficult periods of the epidemic in China. During that time, that 4 weeks, there are about 200 travelers from China detected to be COVID-19 positive. That is a low number because every day our total reported cases is about 1,000. So for the whole 4 weeks running up to 1st January, 200 travelers from China detected to be COVID positive. So they accounted for less than 5% of our total imported infections. ASEAN countries accounted for over 50%, rest of Asia about 15%, Europe 11%, Middle East 9%. Amongst all our imported cases in that 4 weeks, 7 developed severe illnesses and had to be hospitalized. 3 were from the Middle East, 2 from ASEAN, 1 from Europe, 1 from China. Most were Singaporeans returning from these countries and regions. And these are not large numbers, so the impact on our healthcare system was very small. Since 1st January 2023 to today, I did a further check. There has also been no severe infection cases coming from China. Why is it that travelers from China accounted for a very small percentage of imported infections and severe cases when China is experiencing such a huge infection wave? And there are 2 main reasons. It's due to the measures we put in place, and it's backed up by our high vaccination coverage, which is being kept up to date. What are the measures? What are the reasons? First, travel volumes between Singapore and China have been very low throughout the pandemic. As of now, we run 38 weekly flights from China to Singapore, compared to around 400 flights pre-COVID. This translates to between 700 to 1,000 arrivals from China every day. less than 10% of pre-COVID-19 volume. China's opening up to the world is great news and something we are looking forward to so that we can restore our rich and substantive people-to-people links. As China opens up, the Ministry of Transport will carefully calibrate any adjustments from the current low travel volume, at least until the infection wave has clearly subsided in China. Many scientists believe that the current infection wave in China has started to subside, especially the major Chinese cities. It will probably take a few more weeks for the trend to be very clear, and we can then progressively restore pre-COVID flight volumes between our two countries. The second reason is that we have actually been maintaining a test requirement for at-risk travelers. Many Singaporeans actually forgot about it now. Travelers have to be either fully vaccinated based on WHO vaccination definitions or produce a negative pre-departure test or PDT result before heading to Singapore. That is why when Singaporeans are now overseas, when you go to the airport, you try to check in with the airline, you have to produce your vaccination certificates at the point of check-in. This is so that the airlines know and we know whether you are required to produce a negative PDT result before you are allowed to board the plane. Over the past months, actually many Singaporeans have written to me and to MOH to feedback that this current rule causes a lot of inconvenience. They ask, can it be done away with? You know, at the check-in counter, Kalang Kabut, I have to show my vaccination cert. Some of them have to log into their health hub with their SingPass and so on. We have been explaining to them that it is important to maintain it, to manage the risk that we are currently facing, because unvaccinated and infected travelers coming from anywhere in the world are at risk of severe infection and can add to our healthcare workload. Spain, one of the most highly vaccinated countries in Europe, has just announced that they are implementing the same test requirement as Singapore. So in summary, there are three groups of countries with varied responses as a result of China opening up. First, most of ASEAN, Middle East, Africa, South America, New Zealand, which are not imposing any border measures. Second, several countries, namely Australia, Canada, several EU countries such as Belgium, France, Germany, Sweden, India, Japan, UK, and the US, they are imposing a 100% pre-departure test requirement on all travelers from China. And then the third category, just Singapore and Spain, which have the policy of either you are fully vaccinated or produce a negative PDT result. Thailand, we thought we are putting on some of these requirements. I just read that they are taking it off again. So we are neither the tightest or the most liberal, but somewhere in between. And we do not discriminate because these severe cases, they can originate from any country, any region in the world, as shown by our data. Mr. Speaker, sir, our current measures controlling the number of travelers and requiring PDT for unvaccinated at-risk travelers have led to low imported infections and even fewer severe cases from China at the time when the virus is spreading widely in the country. I cannot speak for other countries, but I will now explain why the measures worked so far for us and is appropriate in our current context. Minister Iswaran will further elaborate on what MOT is doing with regard to air travel. But we cannot be complacent. The measures may work now, but not permanently. We will continually assess the situation and, if need be, make adjustments or implement new measures. At all times, our decisions must be based on science, on evidence, and on data. Now, let me first explain our key concerns at this stage of the pandemic. To do so, it is worthwhile recapitulating how far we have come. At the early stages of the pandemic, infections were our primary concern. because it was a disease that could lead to many severe episodes and deaths, and there were no vaccines or treatments available. Under those circumstances, we adopted a zero COVID policy. That means tight border measures, testing every passenger, and quarantining them before allowing them to move around in our community. The same considerations applied within the community, where we implemented contact tracing, quarantine close contacts, imposed strict safe management measures, including a circuit breaker. Then effective vaccines were developed, and they changed our considerations fundamentally. With a great majority of our population vaccinated and many recovered safely from relatively mild infections, our population has developed strong hybrid immunity. Today, the probability of COVID-19 infections leading to severe illnesses or deaths for our population has become very low, comparable to influenza or pneumococcal infections, both of which are endemic diseases that we have been living with for many years and which we have also been encouraging vaccinations for. To illustrate, in the past 30 days, the number of COVID-19 patients in ICU is in the low single digit, and there were 25 days out of the 30 where there were no COVID-19 deaths. Based on severity rate today, annual deaths caused by COVID-19 infections is similar to that caused by influenza infections. Hence, with extensive vaccination coverage, we can treat COVID-19 as an endemic disease. Like influenza, top-line infection numbers should no longer be our preoccupation. So to illustrate again, at the peak of the year-end XBB wave last year, we were registering a 7-day moving average infection of about 8,500 cases a day. So despite the high top-line number, we carried on living life normally. We did not impose further social restrictions. We did without masks even. However, we were watching the situation very carefully in our hospitals because it is the bottom line of number of severe cases and deaths that matter. As it turned out, hospitals were very, very busy, but they were not overwhelmed. And we ride through that wave. Now, our greater concern goes beyond hospital workload and capacity to the evolution of the epidemic itself. Today, the infection waves around the world are driven by variants known to us: XBB, BA2, BA2.75, BA5, BA5.2, BN1, BF7, so on, BQ1, XBB 1.5 now. We know their characteristics and that existing vaccines continue to be effective in preventing severe illnesses of these variants. What worries us most now is the emergence of a new, unknown, and more dangerous variant of concern. Our main worry is that with the virus continuing to spread throughout the world, there is a higher chance that a new variant of concern may emerge from anywhere in the world. It may possess worrying characteristics, escape vaccine protection, be more infectious, more likely to lead to severe illnesses, which will be very bad news. A nightmare variant can knock us almost back to square one. We must then be prepared to hunker down. We may need to reinstate measures such as strict border controls, quarantine for travelers, social restrictions, including limit on group sizes, until a new and effective vaccine is developed. So in short, our key concerns are first, the emergence of a new and more dangerous variant, and second, even in the absence of a new dangerous variant, to protect our healthcare system against having too many severe cases. And this set the context of our border measures in response to the infection wave in China and the winter wave in many countries. Let me explain what we are doing to address each of the two concerns. So let me start with the more important one, which is the emergence of a new and more dangerous variant. The most common measures that we have read in the papers in response to the opening up of China is tests on travelers, COVID tests on travelers. But they do not help detect new variants of concern. It tells us if the travelers are infected with COVID-19 but does not identify the variant. New variants can emerge from anywhere in the world, not just China. So to detect new variants, we need an effective global surveillance system, where samples from infected persons all around the world are systemically collected, the viral genome sequenced, and then shared on a global platform. This is best done by countries for their own local cases, rather than relying solely on traveler surveillance because they can only provide a delayed snapshot. Fortunately, such systems exist today, and the most commonly used global COVID-19 genome sequencing platform is one run by a non-profit organization, and it's called GISAID, G-I-S-A-I-D. It stands for something, but they don't want to spell out anymore. It's just known as GISAID. The data is publicly accessible and protects the ownership rights of the source country. Today, GISAID hosts all shared genome sequences of 4 viral pathogens of global interest currently, namely COVID-19, influenza, Mpox, and then RSV. Singapore actively contributes to GISAID, which in turn works with many countries. GISAID has established a base in Singapore in collaboration with A*STAR, and MOH as GISAID has built up a very strong working relationship. Hence, when a major COVID-19 infection wave broke out in China, GISAID collaborated with the various Centers for Disease Controls, or CDCs, in major Chinese cities and provinces to obtain viral sequencing data. Today, Beijing, Shanghai, Guangzhou, Sichuan, Zhejiang, Jiangsu, Fujian, Inner Mongolia contribute up-to-date viral genome sequences to GISAID on a weekly basis. Just today, you can now find genome sequences from also the province of Anhui. It just fresh came out today. The data are analyzed and processed from their office in Singapore. There are still gaps in the data, so GISAID is working with the Chinese authorities to expand the data capture. So far, the data shows that the epidemic in China is driven by variants that are well known and have been circulating in other regions of the world. Dominating ones are BA5.2, as well as BF7. Our local sequencing efforts on infected travelers from China further supports this. The majority, as I mentioned, BA5.2 and BF7 strains, which have already been detected in Singapore and other countries for many months. Our assessment is also consistent with that of WHO's Technical Advisory Group on Virus Evolution, which just released its findings on 4th January 2023. This is a huge relief. What we fear and worry most, a new dangerous variant that evades vaccine protection coming out from China as the virus spread throughout their population, has not materialized yet. But we will continue to stay vigilant and plug ourselves deeply into the global surveillance system. Mr. Speaker, our second concern is to protect our hospital system. When China announced that it will start to allow leisure visits in an orderly way, many people around the world is imagining a surge in COVID-19 infections from an increase of tourists from China. Singaporeans too are asking if we should implement some of the measures that other countries have announced and are implementing. So let's examine the effectiveness of these measures in protecting our hospitals. First, some countries conduct PCR tests on travelers from China after arrival. But the shortcoming of any on-arrival test is that they are too late because the travelers are already within your borders. Further, PCR tests are sensitive and bound to yield a large number of positive cases from countries that are experiencing or have just experienced a big wave. Even recovered travelers were shed dead viral fragments for quite some time, a few weeks, even though they are no longer infectious. We therefore did not consider doing this, as this would merely confirm what we expect or what we already know. Then there are also wastewater tests. For wastewater test, it is best done on residential premises, like dormitories and housing estates, because viral fragments can only be detected from solid waste. So the sample capture from plain toilets for a relatively short duration flight from China to Singapore is likely to be very small and of limited use. Second measure is PDT, pre-departure test, and that can be useful because it will sieve out COVID-positive passengers, prevent them from boarding the plane, reduce the number of imported infections, enhance severe cases, and the burden on our hospitals. So PDT can be useful. However, as I explained earlier, there is already low travel volume between Singapore and China, which is currently less than 10% of pre-COVID-19 norms. So this already limits the number of imported infections, more so than imposing a blanket PDT requirement on all travelers from China. I believe China is also acting cautiously and increasing outbound traffic in steps and not make a sudden full opening. Minister Iswaran will explain how we will increase the number of flights between Singapore and China in a calibrated fashion as the infection wave continues to subside in China, while ensuring that the health of Singaporeans and healthcare resources are not compromised. I reported earlier that over the past 4 weeks, travelers from China accounted for less than 5% of imported infections and 1 out of 7 severe cases. So if we impose PDT on all travelers from China, questions also arise. How about travelers from other regions that contributed to more infections and severe cases? How about local community settings, which we know are conducive to spreading the disease and can drive infection numbers and severe cases? Further, by triggering PDT on travelers from one part of the world experiencing high infection numbers, are we contributing to an international precedent of imposing tests on travelers from countries experiencing an infection wave? So how will other countries treat travelers from Singapore when we encounter another infection wave? So instead of imposing blanket PDT specifically on travelers from one region or one country, we decided very early on that we should encourage adequate vaccination amongst all travelers coming to Singapore from all parts of the world. And this directly reduces the risk of importing severe cases and protecting our hospital system. And that is why we have until now maintained the requirement that incoming travelers either are fully vaccinated based on WHO definition or have to undergo a professionally administered or supervised PDT. Mr. Speaker, in Mandarin, please. 中国对外开放是世界抵抗冠病疫情的重要里程碑，也是许多国家、行业、企业、家庭、人民期待已久、希望看到的。对新加坡来说，这是重要的发展，能让我们恢复以往的人文交流，促进两国之间的全方位合作。虽然看到的事情发生了，好多公众却觉得担忧。大家恐怕中国的开放会导致新加坡国内一波再抬头，政府再次施行社会安全措施，几年来争取到的自由会不会功亏一篑？卫生部深刻理解这方面的担忧，也会继续维持我们的高度警戒。因此，我们要使用科学证据和数字，策划出最有效的防疫措施。让我们先看看数字吧。去年12月，应该是中国疫情最严重的阶段。那时候，大约有200名来自中国的旅客被检测出感染了冠病，这占我们总输入型病例不到5%，比起我们全国总病例占不到1%。现在许多感染冠病的人士，尤其是那些接种过疫苗的人士，病症都是轻微的，所以我们注重的是严重需要入院疗养的病人的患者。那去年12月呢，来自各个国家的地区，在所有输入型病例当中， 有7个人病情严重，需要入院治疗。他们当中3个来自中东国家，2个来自亚细安国家，另外各有1人来自中国和欧洲。他们大多数都是从这些国家地区回国的新加坡人。病重的人数不多，所以对我们的医疗体系影响是很小的。为什么中国的冠病病例急增，却在输入型以及病重的病例当中只占了非常小的部分呢？主要的原因是往返于新中2国的人次，自冠病疫情爆发以来就维持在非常低的水平。目前我们每周只有38趟来自中国的航班，比疫情前大约的400趟少了很多。乘搭这些航班进我国的人，大约每天有700到1000人，不到疫情爆发前的1成。此外，一直以来我们都有要求高风险的旅客进行检测。旅客要入境我国之前，必须提成冠病疫苗的接种证明，没有的话就要提供阴性的检测证明。因为我们已经预料会有今天这个情况，所以保留了这个非常2个关键的措施，边界措施。许多科学家相信，中国的疫情已经经过了最高峰，在这段最艰难的时间，新加坡的疫情情况保持稳定，可以看出我们这些措施是有效的。但措施不可能是永远有效的。政府抗疫跨部门工作小组会仔细的观察不断改变的疫情局面，检讨我们的措施。需要的话，我们会改变或实行新的疫情措施、抗疫措施。现在让我大略说明我们现阶段疫情的一些主要担忧。第一，就是出现一个新型而且更危险的变种毒株。第二，是保护和保障我们的医疗系统。新型毒株有可能源自任何一个国家或地区，要尽快的发现新毒株的出现，需要一个有效的国际监测系统。这个国际系统名称 GZ， 英文叫 GZ， 它正在和中国各大城市或省份的疾病预防控制中心合作，收集相关的病毒基因排列数据。目前呢，北京、上海、广州、四川、浙江、江苏、福建、内蒙古和安徽，每个星期都会提供最新的基因排列数据给 GZ。这些数据在 GZ 位于新加坡的办公处呢进行分析和处理。GZ 的研究显示，目前在中国传播的病毒毒株都是已经在其他国家和地区传播过的。目前的疫苗也可以针对这些毒株提供很好的保护。这个发现让大家松了一口气。至于保护和保障我国的医疗体系，最重要的是鼓励所有入境我国的旅客，无论来自哪一个国家或地区，接种冠病疫苗。这么做可以直接降低入境感染者的病重风险，而且保护我们的医疗体制。说到底，最好的防卫措施也是每个人都能够做得到的，就是接种疫苗，而且确保我们更新疫苗接种状态。有些人问我，一支过一支的打，要打到几时才打得完？几时可以不需要再接种疫苗？说老实话，冠病疫苗已经成为我们新常态的一环。就像流行性感冒跟其他地方性疾病一样，我们鼓励人们每年接种1次疫苗，就可以避免很多人因为染病病重或病死。就如李显龙总理也在他2023年新年献词中所说的，在去年年底的旅游旺季以及中国冠病病例急增之后，如果本地的疫情保持稳定，我们有望解除最后的防疫限制，正式进入 以后常态. Mr. Speaker, sir, the latest worry about the outbreak in China is part of the new norm. Today it is China, tomorrow another region may experience a major wave. In fact, many regions in the Northern Hemisphere are experiencing rising infections of both COVID-19 and influenza over the winter season. New infection waves are bound to start in Singapore from time to time, over and over again, as variants with immune escape emerge, protection from vaccines and previous infections wane, and reinfections increase. While we step up global surveillance and consider border measures whenever we feel threatened, remember, best defense, and which every one of us can play a part, is to have up-to-date vaccinations. Some people are asking, when is vaccination going to end? How many shots of booster must we take? To be very honest, COVID-19 vaccinations has become part of the new norm. For an endemic disease like influenza, vaccinations are encouraged every year, which will help avoid many deaths. COVID-19 is heading the same way. The current situation where we feel threatened by rising infections around us is a clear illustration why vaccination needs to be an integral part of our ongoing defense against an endemic COVID-19. I'm heartened that most Singaporeans are responding to this. As of 31st December 2022, about 60% of individuals aged 16 years and above are up to date with their vaccinations. Today, about 13,000 individuals are taking the bivalent vaccine on a daily basis. And now, with the introduction of bivalent formulations for both Moderna and Pfizer, you got two brands to choose from. I hope more will step forward to get better protection. And as we move into this new norm, we will never be complacent. But our responses need to be based on science, evidence, and data. We are ready to adjust policies whenever necessary. We will always do our best to maintain our way of life and not go back to the days of lockdowns unless absolutely necessary. And as the Prime Minister said in his New Year's Day message, if the situation continues to be stable after the year-end travel season and the infection wave in China, we can look forward to making final adjustments to our remaining social restrictions to establish a post-pandemic normalcy. Thank you, Mr. Speaker.